winter season starts. And really what I want to say is, first of all, thank you for all that you do to really care for our Boston children and families. I am always in awe of how much you all do to support our families through illness, through other times, and how much you really strive to know this information, right? To be here, to really be able to convey that. So thank you. Today, we're going to talk a little bit about partly three main viruses, RSV, flu, and COVID, and talk a little bit about what's some of the latest guidance that's important for early education care providers to know. I know you get a lot of questions from families around when can my child come back, to the EEC after they're feeling ill? Should they stay home? Should I get tested? We're going to talk a little bit as well about some newer vaccines in the recent weeks that are hot off the press. And then most importantly, and I think the big piece is how BPHC, the Boston Public Health Commission, can continue to support you. We're always here, the Infectious Disease Bureau, and I have many members from my team, public health nurses, health education coordinators who really are here for you. And we're going to talk about a campaign that we have, a multilingual campaign that I hope will be a helpful resource as we aim to get our families to be healthy. I'm going to start briefly with flu. Many of you know, so I'm going to talk about flu, COVID, RSV, and then do some general points. Flu, many of you know, is a respiratory illness that causes many of the same symptoms as COVID, and people can feel quite ill, actually. Many people can get a fever, cough, sore throat. Most people do well, but it can also lead to severe illness, to people getting hospitalized, and sometimes to people dying. We see a lot of flu. This graph here just shows when we see flu in the city of Boston, when it peaks. And we typically start to see it peak in the early December, just after Thanksgiving. But around Halloween and afterwards, we start to kind of see more and more flu. And so as you start to see more, perhaps illnesses over the next coming weeks, certainly a time when we can expect flu or COVID for that matter. But, we start to see it tick up. Within early education and care centers, I want to note that younger children are particularly at high risk for severe flu disease. Children can get ill, especially those that are younger than 2 or 5. And so really getting vaccinated, which I think will be the focus of today's conversation, really encourage information around vaccines and how that can be conveyed to families and how we can partner with you. But also pregnant people and adult with medical conditions are at higher risk for severe flu disease. And so EEC staff, EEC parents and families, it's important for everyone to get vaccinated. But these are some of the higher risk groups that are within our early education realm. And so what do you need to know about flu vaccine? All adults and children ages 6 months and older should get an annual flu shot. The annual flu shot helps protect against severe disease and hospitalization. It can protect people from dying. It's actually very effective. The best times to get vaccinated are now. As you saw from that graph, flu starts to spread after Halloween. And so getting protected and having yourself, your staff, families, encouraging people to get vaccinated is what we're really focusing on as the commission. This is the time to get vaccinated. Everyone should get an annual flu shot. I also like to mention that there's also treatment for flu. Flu, we have treatments for flu. And again, I mentioned this especially for staff or, everyone here, right? To know that, if you're feeling sick from flu, and if you're an adult or a child or, a family member who's at a higher risk of flu, you should always call your doctor about treatments. Treatments can also help to protect someone from needing to be in the hospital or dying. And so again, I really often mention this to everyone here on the call to know that vaccines exist and treatment exists for flu. This graph shows what the flu vaccination uptake is amongst different age groups. And I just really want to echo, we're kind of really looking at the purple graph here that shows that across different years, uptake of flu vaccine has been fairly high in this age group, higher than others, but there's still a lot of work to be done around reminding people to get their flu vaccines. And I think this is really critical to limit illnesses in early education, is for children and families and staff to get vaccinated. I'm going to next talk about COVID. I think I've gotten a lot of questions over the past weeks about what are we thinking? What are we doing when it comes to COVID? How can we think about COVID in this era? We've come a long way with COVID, right? Since 2020. We have a lot of levels of protection from immunity, from all different vaccines that we've gotten, from prior infection. The virus itself has also shifted. And so we're seeing less severe COVID disease as a result of the immunity and sort of the shifting virus over the past years. However, we still have data that show that the risk of death of COVID-19, especially amongst those that are in the hospital, is still higher than flu. And so we're not out of the woodwork entirely yet. And I think a big message around EEC staff, families, is how important it is to stay up to date with vaccines, especially to keep getting that protection, and to also consider other kind of other ways to protect ourselves depending on who you are, how old you are, because we know that older people are at higher risk from getting hospitalized with COVID or dying from COVID. Whether you're vaccinated or not, if you've up to date with your vaccines, you are very protected. If you're not up to date with your vaccines, you have less protection. And then if you have medical conditions, and so again, especially for your staff who might have medical conditions, for children, it's very, very important to stay up to date with flu vaccines. Again, we can expect these viruses tend to spread more in the winter, which is sort of why we're here today, to get ready for the spread of COVID, the spread of flu, the spread of RSV. You're still gonna see children out sick. You're still gonna see staff out sick. And really, I think the vaccines and other strategies can help us to prepare. Just for some guidance to let you all know, we at Boston Public Health Commission publish wastewater data. We measure the levels of these viruses in the wastewater, meaning in sort of water from, stool, toilets that's collected in the Boston wastewater. That gives us an idea of how much virus is spreading. We also still publish data on the number of hospitalizations. And so this data is data that's available to you as residents of Boston, that sometimes people can find helpful in terms of staying up to date about how much virus is spreading. These are some of the other reports that we include. This is all at BPHC's website. So again, just information that people can have, to guide around how much the virus is spreading. I really want to hone in on vaccines. There's been a lot of new news about the new updated vaccines for COVID. Now, a lot of people ask me, why do I need to get a new COVID vaccine? I've gotten so many already. The reality is, and this actually we've seen with other infectious diseases like flu, viruses shift a little bit each year sometimes. They shift with time. And we need to stay protected as the virus shifts. That's one of the reasons, for example, many of us get an annual flu shot. Why all of us, as I mentioned, 6 months and older should get an annual flu shot. And so with COVID now, there are updated COVID vaccines that were approved last week. And the CDC has recommended that everyone should get an updated COVID-19 vaccine. And so those are going to be available, those are going to be available shortly. And so definitely encouraging families to get vaccinated, encouraging your staff to get that updated vaccine. How much vaccine you might need might vary depending on who you are. Some younger children might need more doses than some older children, and it depends on whether those children. But the bottom line is really encouraging families, encouraging your staff to stay healthy and get vaccinated is really, really important. And we have updated vaccines that we recommend that everyone get. For RSV,
and Dr. Sanchez, I'm sorry. There are questions coming in the chat, and I want to know, would you like us to ask you those questions as they come along, or would you like us to hold off and ask questions at the end?
I don't know, Kristen, if you have any other thoughts. I would probably hold off until the end, but okay. Let me know. Does that sound okay? Okay. All righty. But I am excited to hear what the questions are. So for RSV, again, I know last year we talked a lot about RSV because we saw a lot of RSV spread, especially as measures for COVID-19 were lifted, meaning as we started masking less, as we started staying home less, we saw more diseases spread, as we always do. RSV is a very common virus. Most of us get infected with RSV before we're 2 years old. It's a very common cause of sickness in younger children, and especially of pneumonia. And a lot of the symptoms, many of you, I'm sure, are familiar with: runny nose, etc. So it's a very common disease, but it can cause some more severe illness in older adults, especially, and in some children that have medical conditions, but especially in older adults. And so the big update that I have on RSV for this year is that there's actually 2 RSV vaccines that were approved by the FDA and the CDC that have shown to protect adults over 60 against RSV disease. And so the recommendation from the CDC is that adults that are age 60 years and older, and especially if you have medical conditions that place you at higher risk for RSV disease, meaning heart disease, meaning lung disease, asthma, other medical conditions, I would say if you're 60 years and older, you should talk with your healthcare provider to ask about an RSV vaccine and if it's right for you. And I would also mention that you work very closely with young children, right? I think that's something, you are all, especially if you're staff, families, you are all surrounded, right, by many children, close contact. And so that's always something, a pearl that when you're talking to your provider, just let them know that piece about you, because I think that's something important for them to know, for your staff to kind of say. And again, you should talk to your healthcare provider about this vaccine and see if it's right for you. Going over to the next slide. And then oftentimes I say, for families, a lot of, especially for families, you might have some classrooms or cohorts. Some children are at slightly higher risk, have medical conditions, have lung conditions. I mean, your families very well. Oftentimes, what we counsel parents during this season is to really keep a close eye around hand washing. If there's someone sick in the early education classroom cohort, if there's another child that has, medical conditions, sometimes those parents will keep them home just to, out of safe precaution. But really, it's a lot of the same other guidance for other infectious diseases, which is to stay, to avoid close contact with people who are sick, to wash hands often, avoid touching face with unwashed hands, which I know for kids is like really hard. And again, if in any doubt, limiting staying home. Which gets us to a lot of the questions that I know that you all get from parents, which is, when should my child stay home? When can they come back? So actually, I really wanted to show you, there's a diagram of the CDC release that I thought was really helpful, and they actually have it in English as well as in Spanish. And I can put that link in the chat or send these slides, but it talks about isolation. This is for COVID-19 specifically. Now, the big question, the first thing is, if a child tests positive for COVID or if they're sick and, we believe that they have COVID, they should at least isolate for 5 days. They should stay home for 5 days. That hasn't changed. For COVID-19, the minimum that a child should stay home is 5 days, and ideally from the test date. If they tested positive, I always encourage people to count from the test date. Now, when can they come back? This diagram goes through a really nice framework, which is like, is the child fever-free? Are they free of symptoms? And, one of the questions is, can they wear a mask or not? Now, many children I know can't wear a mask, right? And so one of the other options is, can they test, right? I think that the minimum is 5 days. That's what CDC says, but we know that in early education centers, children are more close together. Children often can't wear masks. And families will kind of be really advocating for the child to come back at day 6. And so I think what part of what the CDC recommends is negative test in sort of children before coming back, or again, masking, I think, or kind of continuing isolation until day 10 as the safest precaution. But again, we know that oftentimes it can be difficult, but at the very least, still isolating for 5 days, ideally for 10 in COVID if possible. Otherwise, encouraging families to test their child and making sure that the child is symptom-free. So these are some of the diagrams that the CDC has provided that I hope are helpful. When it comes to exposures, right, I think some of what we have, sorry, when it comes to other illnesses, apologies, when it comes to RSV or flu, and when a child or a staff member can return, it's a little bit different, as you all know. There, it's often, are they febrile without using fever-reducing medicines, and are they feeling well and fully able to participate? If the answer is yes, then the child can come back. What we often tell early education centers is if you are seeing more illness in a given room, then you should call us, because sometimes, even if it's not COVID, we've actually sometimes offered guidance that sick staff and children, if there's a cluster in that, if you're seeing a lot of illness, if you're seeing a lot of spread, you should call us at the Boston Public Health Commission, our Infectious Disease Bureau, and our public health nurses, because we might be able to counsel you on ways to say that children might need to stay home longer if you're seeing a bout of illness that you're just continuing to see spread. But for the most part, otherwise, for COVID, minimum 5 days, ideally 10, but minimum 5. And then for other diseases, when they're afebrile and feeling well. Now, I'm going to kind of land on what is the general guidance for COVID, for other diseases. I think right now where we're coming to is we've all learned how important it is to embed prevention into everything that we do every day, right? We know that the best way to keep ourselves healthy is to do things on a daily basis that will keep us healthy and keep us from getting sick. Staying up to date with vaccines is the most important piece. And I will tell you, having your families be up to date, your staff is going to go a really long way in keeping everyone healthy. People might still get infected, but people will be able to return to the early education to avoid landing in the hospital and to avoid any serious outcomes. And that's really important. The daily routine cleaning that you do is really essential as well. Ventilation, if there are any air purifiers, opening windows as you're able will help to improve the exchange of air and filter air. And then washing hands regularly and really well, teaching children and modeling washing their hands before eating, after coughing or sneezing, and that reinforcement is really, really important. And then again, staying home when sick. And then I always say, other measures depending on personal risk. So for example, I know a lot of people who, staff who work at early education centers who will start to wear a mask around this season because they are older, because they have medical conditions and want to protect themselves. Masks can still really go a long way in keeping people safe, especially crowded indoor settings. And then testing for COVID, having test, to test yourself, others can go a long way. So what resources do we at the commission have? Right now, we're operating 2 standing clinics at the Bruce Bowling Building and City Hall, and those are currently offering flu vaccines. We are still in the midst of launching the new updated COVID vaccines, although it is planned that we will offer those as well in the standing site. And so we will keep you informed of that so that you can access the site if helpful. We are also offering free COVID-19 at home rapid testing kits. And so another resource for you, for families to get at home testing kits and to be able to use them. I still encourage staff, families to consider testing their children when their children are feeling ill. It's always good to have tests at home. When someone else in the household is feeling ill, I think it's always helpful if someone's exposed. And then, again, if someone else in the EEC is feeling ill or testing positive, sometimes, encouraging families to test can go a long way. And as I mentioned, encouraging staff and families to stay up to date with their vaccines and guiding them as to where they can get it. And that's where we can be a helpful resource to you. We want to be helpful to you in terms of educating families on where they can get vaccinated, where there are free resources, and where there are multilingual resources. And so these are some of our sites. And so finally, I'm really excited to share recognizing the importance of early education, of our families needing to get vaccinated. We at the Boston Public Health Commission have launched a flu and COVID-19 vaccination campaign this year. It's a multilingual campaign consisting of brochures, videos, materials, We have English, Spanish, Portuguese, Haitian Creole, Cape Verdean Creole. We have videos featuring healthcare providers and parents talking about the reasons why it's important to get vaccinated or why they have gotten vaccinated. And so really we are here to support. If you think these resources would be great for you or for your families, we are definitely happy to help disseminate those. This is one example of some of our social media images that we're launching. And again, feel free to follow us at Healthy Boston and to kind of share these. We have some videos, and we'll show them if there's time, with Dr. Ojikutu and Dr. Natalie Joseph, who's a Haitian Creole speaking provider, talking about the importance of vaccination, and myself as a Spanish provider around the importance of vaccination. So we have those videos if you find them helpful to share. We also have radio ads. We have MBTA ads, and again, brochures that if you find, if we would love to sort of disseminate amongst your EECs if you find them helpful for families to get. And so this is an example of one of the brochures in Spanish, with kind of our campaign. Oh, sorry, this is in Haitian Creole. This is in Spanish. Sorry, I did a double click. This one is in Spanish. And again, people can always do the QR code, but we have this information around vaccines and family, explaining the vaccine against COVID-19 and how it's safe and effective, and then COVID-19 and sort of your family and, the reasons why it can be helpful for families to get vaccinated as well as side effects. Same brochure in Haitian Creole. And again, we have in other languages. So again, I want to thank you all for your time. I want to thank you all for your interest and again, learning and wanting to be advocates for your families, and just to say that we are here for you. Our Infectious Disease Bureau is here to provide guidance at moments where you need it. If you're having illness in your facility and you don't know what to do, we are here. If you want brochures and want to kind of think about, and it's 617-534-5611. I left out a 1, but I'll put it in the chat. Our phone number is 617-534-5611. And you can also email lmanley@bphc.org. And thank you.
Thank you so much, Dr. Sanchez. So we do have a couple of questions that are in the chat that we can start with. The first one is, how long does the flu vaccine last/stay effective?
That's a great question. We typically say that each vaccine will offer protection for that given season. So typically, that's why everyone needs to get it every year. And part of that is because the virus itself changes, and so the vaccine really is only designed for the strain of the virus that's spreading. So I would say that, you're covered, through the end of the flu season, which is typically in May, and then it's time to get revaccinated with the next flu season, which is now.
Awesome. Thank you. So the other question was where we could get the slide deck that you have presented. And I think if you're able to share it with us, we can put that on our website for them.
Yes, we will. Definitely. We'll share.
Okay, perfect. We can also email it out to folks so you don't have to look for it. The third question was the email of the person to contact for the brochures. And Dr. Sanchez did mention it, and then Takia also put it into the chat. It is lmanley@bphc.org. So that is there for you. The other thing is how you give EEC centers COVID tests again. So if you need tests for your center, where can you get them?
So right now, I would say we are distributing those free testing kits at the bowling building and at City Hall. And so we have a lot of other, we have a lot of kits. If you are in need of any testing kits beyond that, or, for some reason, you can always call us and we'll find a way to, right now we're distributing it through those sites, but we can try to figure out ways if there are other testing resources that we can support.
Perfect. There are questions in the chat that are not in English, and I'm sorry, but I am monolingual.
I see a few in Spanish, but I know Spanish, but I don't know if we should translate formally. Let me know.
So I'm a bit confused about the question, and I see that Maritza added it. It says relación variantes que desarrollan virus.
Yes, I also, Maritza, would you like to unmute and ask?
Sí, gracias, Paola y equipo. Con relación a la pregunta de los variantes, pasa de que, ejemplo, un niño ha pasado por COVID. Luego el niño puede tener una recaída que puede ser una gripe, pero no hay diagnóstico nuevamente de COVID. Entonces, cuando podemos nosotros saber si el niño puede ser de una variante que tuvo COVID o no, porque como los síntomas son similares, para poder nosotros estar un poco equipadas.
So that's a great question. We've seen it all. It's going to be kind of my answer to that. We've seen people get COVID-19 and flu at the same time. We've also seen people get COVID-19 now and get COVID-19 and get COVID, 6 months later. And, people can definitely get different infections at different levels of time. And so, I do think that people, to answer the question, we can see children, staff being sick with different viruses at the same time or in different levels, different times. And so that's why it's so important to stay up to date, for example, with vaccines for all of them, right? As you are eligible, specifically here, for most people, it's going to be CDC and flu. And then for people who, who are older than 60, to talk to the doctors about RSV. But the reason is that, you need to be protected against each virus because they're different and we can get them all. Does that help? What I do want to highlight is that a lot of the measures that we shared can help protect against that. That's the flip side here, is that even though they are different viruses, they spread in similar ways. And so all of the tools that we've discussed, the vaccines for each of them, sometimes even wearing masks, staying home when we're sick, cleaning and disinfecting, opening windows and sort of, being outside as we can, all of those strategies work for these viruses because they spread in similar ways. They spread through the air for the most part. And sometimes when, we shake hands, kiss, very, very close contact. And so that's why preventing and all of these actions that we talked about are really important. So thank you for the question.
Muchísimas gracias a ustedes.
So I think that we've answered all of the questions that are in the chat. Does anyone have a question that they'd like to ask live? You can certainly raise your hand and come off mute as we call on you. There's also the opportunity to continue to put the questions in the chat. Noel, you had a question?
Yeah, hi.
Hi.
There was something on the slide about the RSV vaccine being effective for 2 seasons. So does that mean that vaccine has to be taken like every other year?
That's a great question. We don't know yet. This vaccine was tested across 2 seasons. And so that's the data, that's how it was studied. They took adults that had, they vaccinated and then they watched those adults for 2 seasons to see what happened and to see, what was the difference in terms of those who were vaccinated and those who weren't in terms of whether they got RSV or not. So they only followed them for 2 seasons. But we still don't really know you know, when the next vaccine is going to be. So that I think that's one that we're going to be learning more and more, because this is the first time that this vaccine is going to be, you know, that these 2 vaccines are being released. So that's a great question. Stay tuned.
Thank you.
Yeah.
One of the other questions that's in the chat is it possible to send the tests to our address?
So we at the commission haven't been sending testing kits. I can ask, but I do know that the federal government just relaunched the program around testing kits to sort of send them to personal, you know, sort of send testing kits for free. And so I definitely would encourage facilities to, you know, families, et cetera, to order those. Because they just announced that they're going to be, you might recall, last year, or maybe 2 seasons ago at this point, you could order through the postal office, I believe, submit for 4 tests. So I would definitely do that. I can maybe see, I haven't checked if there are any links for that. But we can look. But I will let you know if we come up with any program to do that.
And in the meantime, you are all encouraged, if you are able, to go to City Hall or to go to the bowling building to pick them up in person. Are there other questions that people might have?
As we await questions, I wasn't sure if we could potentially show one of the videos for our campaign, or again, we can stay on, but we do have kind of a few videos, and I would love to but let me know. Oh, is there a limit to the testing? One more question. I don't know if there's a question in the chat about, is there a limit to the number of testing kits that we could get? I don't know that. There might be, but I don't know what it is.
All right. Do we think we can get the YouTube video of Dr. Ojikutu playing?
Yep, just give me 1 second and I will play
Okay.
it.
Yay.
While we're waiting, are there any last burning questions?
I think I placed the CDC links to the PDF documents directly, so those should be there. Perfect.
Okay, let me just.
You want the best for your baby and yourself during pregnancy, including the best protection against flu and COVID-19. No matter where you are on your pregnancy journey, getting vaccinated against flu and COVID-19 can help keep you and your family healthy and safe. Because a baby's immune system isn't fully developed at birth, they need additional protection. When you get vaccinated while pregnant, it can keep you healthy and keep your baby from getting sick. Vaccines are safe and effective for children as they grow. Keeping you and your family up to date on vaccines could mean less time at the doctor's office, more time in daycare or school for your children, and more productive time at work for you. Stay up to date with your vaccines. Stay healthy. Talk with your trusted healthcare provider today.
I don't know if you guys are still seeing my screen or not. Can you tell me?
No, we are no longer seeing your screen, Takia. So we have, Takia, could you remind us the languages we have for those videos?
Yes. So we have the languages are available in Haitian Creole, Cape Verdean Creole, Spanish, Portuguese, and English.
We can maybe send some of those links along so that you can, so that you can help us spread the word. Again, I really do think one of the most important things for us to all stay healthy this season and for our facilities to stay open, to stay healthy, to stay safe is for our families to get vaccinated. And so as much as we can, that's what we at the Commission and IDB have been really prioritizing is how to support that. Oh, thanks, Takia. That's the YouTube link?
Yes, and all the videos are available on the YouTube link.
Awesome. Should we show some of the other languages? I don't know if we have time. Let me see.
Did you want me to show Dr. Joseph's? And we also have our Spanish speaking parents and Portuguese speaking parents as well.
I think since we have Spanish speaking and Portuguese speaking folks on this call, those would be the two languages. So take your pick and show us one. And I think, while Takia is teeing that up, I want to make sure that everyone knows for questions moving forward, they can contact the Boston Public Health Commission. We've got these links that are in the chat, which we will make sure are also in the follow-up materials with the slides. So just as people are looking through and listening at the end, if you don't have any final questions, we will be sure to make sure that you get all of that information. All right, here we go.
Usted quiere lo mejor para su embarazo y su bebé. Esto debe incluir la mejor protección contra la gripe y el COVID-19. En cualquier etapa del embarazo, vacunarse contra la gripe y el COVID-19 ayuda a preservar la salud y seguridad de toda la familia. El bebé necesita mayor protección porque su sistema inmunitario no está plenamente desarrollado. La vacunación durante el embarazo le permitirá preservar su salud y la de su bebé. Las vacunas también son seguras y eficaces para los niños. Estar al día con las vacunas puede significar menos tiempo en el consultorio médico, más tiempo en la guardería o en la escuela para sus hijos y más tiempo productivo en el trabajo para usted. Tenga las vacunas al día. Cuide su salud. Hable hoy con su proveedor de atención médica de confianza.
Thank you, Takia. And thanks, everyone.
Thank you all very much. Thank you for spending time with us today, Dr. Sanchez and Takia and the rest of the Boston Public Health Commission team. I want to thank you providers who I know took time out of a very busy day. We will be sending the materials out to you as well as posting them on our website. So if you have colleagues who, for one reason or another, couldn't join us today, just make sure you mention that they're on the website and we'll get the recording and the other materials in their hands. But with that, we wish you a healthy and safe fall season, and we'll talk to you again soon.
Thank you. Gracias. Bye.
Gracias a ustedes, muy agradecidas para nuestros programas tener esta magnífica orientación y prevención, sobre todo el tema del COVID. Muy agradecidas.